The second trimester, the belly's true appearance. The real adventure began in weeks 13 to 20. This was when mommy's belly started to show its true shape. At first, it was just a slight bump, like after a big meal. But as time went on, the protrusion became clearer. Old clothes began to feel snug, and mommy started looking for looser attire. This was a joyful moment, as the growing belly became tangible proof that a new life was thriving. Around weeks 16 to 20, mommy started to feel tiny movements, like the flutter of butterfly wings or bubbles inside. These were the eagerly awaited first fetal movements. Mommy's belly was now roughly the size of a small volleyball. Upon reaching weeks 21 to 28, mommy's belly was very noticeable. There was no hiding it anymore. Its shape became rounder and more prominent. Fetal movements were stronger and more frequent, sometimes feeling like tiny kicks or punches that could even be seen from the outside. During this time, a vertical dark line called the linea nigra might start to appear down the middle of the belly. The skin around the belly could also feel itchy from stretching, an early sign of the skin stretching to form stretch marks. Mommy's belly was now about the size of a mini basketball, and every day it felt heavier yet more meaningful. The third trimester, a big belly and hopeful anticipation. Entering weeks 29 to 36, mommy's belly had reached a considerable size. It felt like carrying a watermelon everywhere. The belly skin felt increasingly taut and tight, and stretch marks might become more apparent. Fetal movements became more dominant. Mommy could feel the little one hiccuping or even turning around. Sleeping became a bit challenging, as finding a comfortable position with such a large belly was not easy. However, every discomfort was repaid with each movement and the hope of an upcoming meeting. Finally, at weeks 37 to 40 or more, the peak of this journey arrived. Mommy's belly was very large and felt full. The baby was in a ready-to-be-born position, and the little one's head had usually dropped into the pelvis, making mommy's belly appear slightly lower. There was a sensation of pressure in the pelvic area, and sometimes mommy felt Braxton Hicks contractions, a kind of gentle practice for the actual labor. Breathing became a bit shorter as the enlarged uterus pressed on the diaphragm. And then the long-awaited moment arrived. Mommy's belly, which had been a warm home for the little one, would soon be a silent witness to birth.